Hi, I am Dr. Santhosh Bethur. I am a senior consultant in the Department of Urology and Renal Transplantation, Aster RV Hospital, JP Nagar, Bangalore. Today I will talk about one of the most common malady or one of the most common disease affecting men. This is called prostate enlargement in the common terms, or we call it as benign prostatic enlargement. It nearly affects almost all the men, or at least I would say 60 to 70% of men over the age of 70 years. It can affect younger people, but then the reason being infection in those patients. But in most of the patients or most of the cases, the age is usually more than 60 years of age. The prostate is a small walnut-sized gland situated in front of the urinary bladder. It secretes certain substance which will form a part of your semen, which has a function or role in the reproduction in the initial part of their life. As the people they grow old, usually that function is lesser, but then prostate gets enlarged, usually the reason being hormonal imbalance. The symptoms of prostate enlargement doesn't depend on the prostate size. What I mean to say is somebody with a smaller size prostate may have severe symptom and somebody can be having a large size prostate without any symptoms. The most common symptoms being difficulty in passing urine, frequent urge to pass urine, and you have to wake up many times in the night to pass urine. There may be burning sensation while passing urine. You may see some blood in the urine, or the need to pass urination urgently. These are the very common symptoms of prostate enlargement. Whenever these symptoms are there, your doctor will perform very simple tests like urine examination, an ultrasound scan to assess the size of the prostate, and they will do a test called serum PSA, or a specific blood test to rule out prostatic cancer, because a small subset of these patients with prostatic enlargement can have prostatic cancer. So this blood test will try to rule that out. And lastly, but not the least one, it's called uroflowmetry. We can assess the flow rates of the urine, and this will give a more objective idea of the patients, how much severely it is affecting them. Once the diagnosis is done, the treatment depends on the severity. It can be as simple as a tablet, one tablet a day, or it can be surgical treatment like prostate removal. Nowadays, we have extremely well technological advances in urology department, mostly to do with the prostate enlargement. We have different kinds of laser. We use them to remove the prostate. The advantage of all these procedures are very minimal or less duration of hospital stay, and the recovery is extremely fast. These can be done in the patients even suffering from cardiac diseases or diabetes or other multiple comorbidities. So these give long lasting benefit. If somebody doesn't want to continue medications, surgery can be done, or if medications are not working, then surgery can be done, or there are some specific indications where surgery is the only form of treatment. Most of these procedures are minimally invasive. Just 1 or 2 days stay in the hospital. You don't need to take any bed rest or long stay away from your work or routine day-to-day work. If anybody is suffering from these kind of symptoms, I would recommend you to meet me at Aster RV Hospital, JP Nagar.